Good afternoon, everybody. My name is Matthew Kelway. I'm the Director of Nursing and Health Policy for the Registered Nurses Association of Ontario, and I want to welcome you to our media conference this afternoon. Our media conference is about Bill 124, the government's wage restraint legislation, and the deepening nursing human resource crisis here in Ontario. We have several speakers who will give remarks this afternoon. We will start with RNAO CEO, Dr. Doris Grinspun. Doris.
Thank you very much, Matt. And I'm accompanied here with our president-elect, Dr. Claudette Holloway, and with Leah Waxman, one of the colleagues from Nurses with Signs, which actually started this campaign. So thank you, Leah, for joining us, and thank you also to Nancy. Colleagues, some of you may know that when our colleagues started the campaign, Repeal Bill 124, RNAO actually did not join at the beginning because we thought this was a matter of our colleagues in the union, and that this bill was a strange bill, but was not our place to get involved. That has changed significantly since the pandemic came to us. While we didn't invite the pandemic, nor did this premier created that bill, and it is our view that Bill 124, the day that the pandemic was called as such on March 11, should have been repealed. This bill is an affront on nurses in the front lines at the time that they're giving it absolutely everything. This bill is a slap in the face after 22 months that we are confronted with a devastating pandemic where they have needed to cancel vacations, cancel days off, lived with fear during first and second and third wave, risking their lives and their families before vaccination, and now yet again in front of a holiday that likely most of them will need to cancel, and we will need to see them again and again and again at work. I am sorry for the disruption. This media has been constantly calling, so apologies for that. The reality is that we have warned about the nursing crisis for many years. Government after government, and the current government also. And while again, the premier does not own only this nursing crisis, he's deepening this nursing crisis significantly by ignoring the plea of nurses for a life-saving jacket. That's what I would call a repeal of Bill 124. The repeal of Bill 124 will not fully solve the issue of the nursing crisis, but it is the life-saving jacket that will say to nurses, please know that we are listening to you. Please know I, as a premier of this province, am acting. And yet, despite that this is a premier that speaks with me often, and I speak with him often on Bill 124, I have heard zero from the premier. Not an answer to my calls, not an answer to the text messages, not an answer to our letter. And let me show, please, Ifra, the campaign that we did, thinking that if all parties will come and support him on the repeal of 124, that he will see it as right in the face of Delta variant and an Omicron variant that is galloping, that at 3 we have yet again Dr. Kieran Moore speaking, and again on Thursday he will speak. The government is scrambling on the issue of this 5th coming wave of the pandemic, and yet he does not understand the seriousness of the nursing crisis. Let me show you, colleagues, out of the parties, 40 out of 40 sitting MPPs on the NDP have signed the pledge that if Premier Ford sees at some point right to repeal this bill, they will show their sign. We are with you. We understand the issue with nursing. We will support the repeal. Let me show below. Liberal Party. Liberal Party, 7 out of 7 sitting MPPs. And Leader Del Duca said to me, even he's not a sitting MP, he's in full support. Again, will stand up and say, we support you, Premier. Repeal this bill. Green Party, Mike Schreiner, spoke in the House, and so did several NDP MPPs, and so did Liberal MPPs. All of them in unison understand that this bill must be repealed to basically give back some oxygen to nurses, so nurses do not leave their work in hospitals to go to an agency where they get 2-3 times the money, or go to another jurisdiction that doesn't have Bill 124, or worse even, leaves our amazing profession altogether because they had it. Today I had several interviews, and for the first time, and my colleagues know how positive I am, and so does the media, I said, I raise my hands. So this press conference is not really for the media. This press conference is for the public of Ontario. It's to tell Ontarians that if it comes a point, and I believe it will, and my organization, RNAO, and my president, Morgan Offart, who is in the front lines now, and Dr. Claudette Holloway, who will speak soon, we believe that ICUs will be full. We know that emergency departments in some hospitals already have closed during the weekend. We know, as everybody else knows, it's because there are not enough nurses. So this is a message for the Ontario public. We have tried at no avail, to no avail. We have tried and tried and tried daily during the day hours, the evening hours, the night hours, the weekends, and we will do that on the holiday too, to try to make some sense for Premier Ford that he is acting in a way that is compromising directly Ontarians' lives. Because if there are no RNs in the ICUs of this province, if there are no nurses in all the other units, then we will be in the situation of Manitoba. Manitoba right now cannot take more patients to ICUs simply because they have not enough RNs. They are now calling on the federal government to send RNs specifically to Manitoba. You will see that happening here, except that the federal government doesn't grow RNs on the trees, nor do we. And that is why it's critical that we do everything we can to retain every single RN in Ontario's hospitals, in home care, and in all the other sectors. I will stop for a bit and ask my colleague, Leah Waxman, to speak about her view from the front lines of care and why, Leah, you started with Nancy Halupa, that amazing campaign that has made us all so keenly aware of the disastrous impact, the slap in the face that this bill means for nurses. Please, Leah.
Thank you, Doris. The history of the campaign was basically me and Nancy feeling powerless and fed up with the support we weren't receiving and the heavy patient loads and short staffing and all the issues that we're talking about right now. And one night we just wanted to let the public know, and we brainstormed how we could do that without necessarily getting flashback from our employer. And it's spun from there. It seems that lots of nurses have lots to say, and they wanted to remain anonymous but still share their stories. And it's gone across the country, it's gone across the nation. All the nurses are feeling the same kind of pressure, short staffing, no support. And Bill 124 just makes it that much worse. It's just the government saying that they don't really care, even with all of our pleas from all over nurses going unanswered. We've been calling out to him since August when we started the campaign, and we've heard nothing.
Thank you, Leah. Thank you, Leah. And if we may, Dr. Holloway, and then I will take it back for a few minutes.
Good afternoon, everyone. Thank you for attending our media conference. We are just days away from seasonal holidays. However, I have never been more worried about my nursing colleagues. There will be little time for much needed rest. Nurses are a critical line of defense in the fight against COVID-19, and yet they have never felt more demoralized. We just heard from Leah. Many begin their shifts and learn that some of their colleagues will not be there to work alongside them. Some are sick or at home recovering from exhaustion, or as we are learning every day, they have moved on to work in other jurisdictions, or worse, they have left the profession altogether. Bill 124 is largely to blame. It represents a sucker punch to the profession at a time nurses need to feel appreciated and valued for what they do. Bill 124 is a message to nurses that they are not valued, and it negates the integral role they play in the Ontario health system. The effects of this bill are playing out in real time. We are bleeding nurses, especially RNs. We have to stop the hemorrhage now because patient care is already suffering. And every day that passes, it becomes worse. The irony is that we are at such a crucial time in the pandemic that we cannot afford to lose one single nurse, not now and not in the future. A few weeks ago, we saw what seemed to be like some light at the end of a tunnel with news that children between 5 and 11 could receive vaccines. Now, a new variant is spreading so quickly. There is growing sense of shock at the power of Omicron and the hold it is taking on our communities. It threatens to overwhelm our health system. And without enough nurses, this will happen. Nurses have been at the epicenter of this pandemic for 22 months, and they will continue to be at the center of the fight. This government, Premier Ford's government, must show the respect that they deserve. And the most pressing way to do so is with repealing Bill 124. It is an essential first step to tackling the nursing shortage in the midst of the worrisome pandemic. Premier, we implore you again and again, repeal Bill 124 as a first step to bring hope back to nurses. Thank you.
I will, for a second, comment. Thank you very much, Claudette and Nancy, and Leah and Nancy. Nancy's sleeping after the shift, so just so people know about employers. Because I need to share that many employers have actually called me as late as last night at 11 p.m. And the Premier likely knows this, and people in the Premier's office likely knows this. Employers, including CEOs and presidents of hospitals, are afraid of speaking up. The Premier knows likely that his power to retaliate on system leaders is real, that they're afraid about the implications if they speak up about what they're seeing in the workplace. So, Premier, I often have said to you, you're different than Premier Mike Harris, but I need to say today, it's looking more and more the same, because I don't recall other governments that actually muzzled people to speak up. But here is the thing. During SARS, we did a press conference with masks that said silence, ignored, muzzled. This is not a threat. This is a word of caution to the public. When you hear people like Leah saying nurses want to speak anonymously because they fear repercussions, when you hear me telling you that presidents and CEOs of hospitals are calling me because they're afraid of speaking up, we are taking the safety valve of the system. So not only we are bleeding, as my president-elect, Dr. Claudette Holloway said, nurses and in particular RNs, because they have the expertise and the luggage here and they take it with them wherever they go. Not only we are bleeding nurses and RNs in particular to agencies that pay them 2-3 times, or we are bleeding them to other jurisdictions or to the US that is taking them like this. We are also taking the safety valve of the system. We are taking that by nurses being afraid of speaking up and speaking anonymously. We are taking it by CEOs of hospitals afraid of speaking up. We're taking it by OHA, and the Premier knows that my counterpart in the OHA never agreed to Bill 124, but they're all afraid of speaking up. So Premier, at the end of the day, for nurses, for us at RNAO and all of my colleagues, it's only about the people of Ontario. For us as nurses, and you saw it, how vocal we were during the tragedy in long-term care, it is, and it always will be only about the people of Ontario. And that's why this press conference is indeed for the public, to notify the public and put them on notice that RNAO and my nursing colleagues in the front lines of care have done everything we can to help the Premier understand the gravity of the situation. And yet the Premier is refusing to act on it, and we will continue to hemorrhage nurses out of the system, and will come a day, it's already here, where there will not be enough nurses in the ICUs of this province, despite the announcements of new hospitals, and where patient safety will suffer, and that is happening as we speak. Today, we had 14,029 additional cases, new cases of COVID-19. Today, we had 5 new people dying. I cannot say, and my colleagues cannot say with certainty, if they only die from the virus or they die because that nurse that was looking after them was doubled with 2 patients in an ICU or tripled with 2 patients in an ICU, and it's impossible to provide safe care in that way. So Ontarians, we regret to tell you that it's not we that will fail you. My colleagues, Leah, Nancy, and the hundreds, over 100,000 RNs and RPNs in Ontario, and nurse practitioners, they love our profession. They want to provide safe and quality care. Their hands and arms strung by the workloads they have, by the incessant disrespect that they perceive. And the Premier today can take an action. Today, he can join today. He could have joined here. We invited him. He can join Dr. Moore at 3 p.m. and announce that he is listening and will repeal Bill 124 as a start to repair and rebuild the profession for the sake of Ontarians. Premier, it's time to listen. It's time to act. The regrets and the prayers later on will not help us bring people back. So please act now. Let's show, if you don't mind, Matt, if you can show the next step of still to have a festivity, still to try to celebrate, Matt, and still to engage the public and nurses, both, in sending greetings to our MPPs and a reminder about the bill if you can show to them, please.
Certainly, Doris. And Ifra, could you share a screen so that we can return to the holiday card campaign? And while you're doing that, if I could invite any members of the media online who have questions to use the raised hand function, please, and we'll get to you after Doris introduces our holiday card campaign.
So we were struggling, because we are struggling to help the Premier understand on how can we do it in the middle of an upcoming holiday that we know our colleagues will be, most of them, at work, and do it in a way that recognizes those MPPs from 3 parties that all of them signed. And we remind the others that while they're, having a good time with their loved ones, to take a minute to reflect and to sign the Repeal Bill 124. Because it is clear to us that there are nurses in that party. There are pharmacists in that party. In Premier's 4th party, there is a nurse, Natalia Kosandova, who I am one of her mentors. There is a pharmacist, Jeff, who is terrific. It is clear that if people like they have not signed, that the orders are from above, because otherwise I'm quite convinced that at least the health professionals in Premier's 4th party would have signed the card. So given that this is an order from above, and that's the way we interpret that, that's why we're asking Premier 4 to change his mind. But meanwhile, we are pleading to all those that have not signed to go to the holiday card, read our good wishes, and sign the card. And for that, we're asking the public to select. You can look in the website. You can look if your MPP signed. If your MPP has signed, you select the card of Happy Holidays. Thank you for signing. And you can either print it or you can send it online. We are making it convenient for you. And this is not only for nurses and other health professionals. This is for your families, for friends, for people from the public, because anyone at any point, even when we don't know today, may need a nurse tomorrow. And then those that have not signed the card, if you find one that has not signed the card, then go to the section that says, use this for your MPP that has not signed the pledge. Again, if you are going to take the time, and we will be thrilled if you do, to go and drop the card, please print the pledge, put it inside the card that we are providing, unless you want to do your own, and that's okay too. Go and give to your MPP. We wish that you take a picture, and you can either put in social media the picture or send it to RNAO, and then we will post it for you. Let's, for once, be together. Let's together stand with nurses, because nurses want to stand with the public. And as my colleagues already said, Bill 124 is actually an easy task for the Premier to act upon. To, have nurses graduate from a 4-year program and then have a certificate for ICU, that takes time. And yes, we can continue to work on all those aspects. But what we now need urgently, absolutely urgently, is to retain every single nurse, whether it's for 1, 2, 3, 15 more years, like Lindsay that quit after 15 years because couldn't take it more. We need to retain those nurses here in Ontario, and the piece that the Premier has full control on is to repeal Bill 124. Matt, I don't know if you want to add any more explanations. By all means, please.
Well, Doris, there's a question for you, actually, or Claudette, on the Q&A function from Eniku Tekur. and I'll read it for you. Anakul asks, does RNAO have a plan in place, assuming Premier continues to ignore taking action on Bill 124 to protect the public and nurses, and what can the public do to help?
So we are not going to disclose what are the next plans, as we didn't disclose till today about the holiday card for obvious reasons. And the most important reason, Anakal, is that we are hopeful that the Premier will reconsider. We are very, very hopeful. We have no interest on going like this. It's not what we want. We want to go like this for the sake of the public. So that's number one. Number two, how can the public help? Please, Anakal, put in your newspaper and in all the other media that you are so skillfully and amazingly engaged, because you have interviewed me in the past, and I appreciate your work and the work of all the media immensely. Please put the link in your story, because we want all the people of Brampton to actually look if their MPP has signed. If their MPP has signed, choose the card that is Happy Holidays, thank you for signing. If the MPP has not signed, put the pledge, go to the person, to the MPP, give them the card or send it online. And that, if the Premier will see that colleagues on his caucus, the 60 of them are getting tons of letters, that the public is standing for nurses, because the public will need a nurse at some point, today or tomorrow, you never know, hopefully never, but that's unlikely, then that's the best way of helping. Claudette and Nancy, any other ways that you would like to share?
Claudette speaking. We as RNAO members regularly get in contact with our members of provincial parliament. So we encourage the public to continue to do that and bring these same issues forward. And many of our people in our province might say, well, I go to the hospital and I don't really notice a difference. But the problem is because the nurses are working overtime to make up, but they cannot continue to do this. So you may not have noticed, but that nurse may not have had any lunch. That nurse may not have had any days off. That nurse may be working way past her time. Sometimes they're being told they have to work. They can't even volunteer. And because of the nurses' interest in the public, they're doing whatever they can. So please help the public to understand that even they do not see the gap, there is a huge gap there. The nurses are stretching beyond their bounds to meet the needs.
Thank you, Claudette. Leah, Claudette, Doris, we know that Dr. Moore has a press conference at 3 o'clock. Any final few words to those in attendance today? Leah,
Nancy,
you first, perhaps?
Nancy, any words? Leah, sorry.
Claudette speaking until Leah can get her connections going. It's very important to pay attention to what the government is doing. The government needs to put things in place to assist us. And even with Dr. Moore, with the press conference now, you will understand how the numbers are rising, how Omicron is an issue, and this will impact, as Dr. Grinspun said, how we have overburdened our intensive care units. And this again comes back to the nurse. And so please pay attention that it could involve any of us at any time. None of us know when we will need the help of a nurse and the healthcare system.
So I think, Matt, just because we all are eager to hear what Dr. Moore has said, is saying we will leave it at this. Leah also wanted to go and listen to Dr. Moore. So we will leave you all with the best wishes for good health, please remind people to get their booster shots as soon as they can. Try to convince more people to get the vaccines if they have not at all, including the 5-year-olds and up. Make sure that you use your mask, ideally KN95, not only the flimsy blue masks, as I call them, because today we know that this is aerosol. We knew it for a long time, but it's quite well known that we need to use masks that are tight, that cover the nose and everything. And if all fails and you get sick, you need to know that there is a nurse there. And for that, we need your help of go to the site, send a card, ask your family, ask your friends, ask your community, ask your church, ask your mosque people, ask your synagogue, anywhere that you are, please ask them to help nursing so we can help you. Thank you very much, and best wishes for health and for the holidays.
Thank you, Doris. That concludes our press conference today. Thank you all for coming. Please be sure to check out our newsroom at rnao.ca for a media release detailing our holiday card campaign. And on behalf of all of us at RNAO, wishing you all happy, healthy, and safe holidays. Goodbye.